Finally, with that, I'm going to turn it over to Dr. Ramani for introductions to this BEI Global Cafe. And I just want to thank again all of our participants and our students who have joined us across the globe. Subha?
Thanks, Erik. Welcome to everyone from any part of the world and all parts of the world. So I really am exceedingly proud of this particular session. And, having been the architect of this model of session, some of you have already attended similar sessions, but I feel really proud because my passion for mentoring, give and take, multi-level conversations, having fun, and learning from each other. These philosophies are really fulfilled by this type of World Cafe sessions. And I know three of the panelists. I'm very proud to have met them virtually. Actually, one person I've met in person many times, but two of them virtually. And I'll introduce, and it's a pleasure to introduce all of them. So this series, one other thing I wanted to mention was we are trying to write up because this is truly an educational innovation. So we will ask you for some comments at the end, and we may use excerpts from your narratives, but we have an IRB. We will not identify any of you. We'll just take excerpts to say what is the impact of this series. With that, let me introduce you to the four wonderful panelists, all final year medical students from 4 continents. Lestat Ali is a final year medical student at Harvard Medical School. He did his clerkship year at Brigham and Women's Hospital, and he is a future physician scientist. And he will be absolutely wonderful because he's actively engaged in a mix of bioinformatics and immunology research at Dana-Farber Cancer Institute. So one day I will be proud to say, oh, I knew him once. And next, Ms. Phillipa Lantwin, whom I've had the pleasure of knowing for a couple of years now. She's from Germany. She's a final year medical student at Ruperta Carola Medical Faculty, Heidelberg. She's a liaison officer for medical education at the European Medical Student Association, EMSA, and an executive committee member of AMI, which is an international association for medical education. And we are fellow executive members of that organization. Mr. Abdullah Al-Khafajy, tell me if I'm pronouncing it completely wrong. Abdullah is a final year medical student at Baghdad University College of Medicine. And he has an international reputation in particularly the area of student and youth advocacy on a regional, national, and international level. He's a liaison officer for medical education issues at the International Federation of Medical Student Association, IFMSA, which represents 13 million medical students from 134 countries. He is also an executive council member of the World Federation for Medical Education, WIFME, and an executive committee member at AMI. Now, Azhar Adam Nadkar, I met during one of our virtual World Cafes. And I mean, his personality is larger than life, and Zoom does not prevent it from being transmitted. I can tell you that. He's a final year medical student at Stellenbosch University in South Africa, student representative of the Southern African Association for Health Educationalists, SAHI, which actually does phenomenal annual conferences, and I'm hoping when the world opens up to visit. He's also the AB Student Task Force Coordinator for the AB 2021 conference. With that, I'll just briefly tell you what the agenda is. The 4 panelists, or the 4 experts as we call them, they will do their brief presentations of how they've experienced teaching and learning during the pandemic. Once they've done with their presentations, we will then have breakout groups, 4 breakout groups, and each of the students will be in one of the breakout groups. And we'll post the questions for groups 1 and 2 and the questions for groups 3 and 4. It'll be a quick 10 to 12 minutes, very efficient discussion, and the group moderators will come back and present their findings or their strategies to the 4 experts, after which I will summarize and we will thank them all and bring this wonderful series to an end for this academic year. Okay, so with that, how about, let's see, that's the 4. Here is the world with multiple flags, and we are all together and we are going to be teaching and learning from each other. And there are the 4 experts for today. With that, I would like to invite Phillipa to start her presentation. And Phillipa, just tell me when you want me to forward the slides and I will do it for you.
Perfect. Thank you for the wonderful introduction, and I'm very happy to be able to speak first. So I'm gonna give you an overview of my personal experience, the German and the European experience this year. So I'm a last year medical student in Germany, as Subha introduced me, so we can jump right next to the next slide. And yes, so personally for me, I was in my last year. So in Germany, you have to do a final examination to go into your last rotations and then finish with an oral. And for me, it had a huge impact because politics decided that I wouldn't be able to do my exam. So they just completely changed the way the studies roll. And I had planned rotations in Brazil, couldn't go, but I did them in Heidelberg, at Switzerland, and Berlin in the end. And it changed quite a lot, mostly structural, because in Heidelberg, people overestimated the first wave, and there was a really empty hospital environment, no official teaching classes because everything unnecessary was cancelled. I got a huge amount of money, but almost no teaching. So I was almost left on my own. I had really to navigate and to get my own learning experiences in. In Switzerland, they almost changed nothing. So it was a kind of standard experience. And in Berlin, then in the end, I ended up in the second wave in Germany, which people underestimated. And I didn't get a vaccination, although it was already available, because as students, I was kind of in between of chairs. I didn't get any money, but I was deemed an essential worker and I was in work and quarantine in between. So that's about my personal experience. In EMSA, did survey right in April 2020. Go back, please. Yes. And you can see just 2 graphs from the survey we did about the education. And one of them is about how happy students were with student involvement during that phase. And you can see it's quite mediocre. So it could have been better, but it hasn't been bad at all. So for some, a really good experience. And the second one is, I think, one of the most crucial. It's the question whether people had devices provided, and most of them answered no. And a lot of them also just didn't know whether there were any provided. So I think this is something where we need to better for the future. And here a short overview of our student employment. The real takeaway of this is also that people in the beginning didn't expect a lot to change. They were a little bit afraid that their transition to a junior doctor would be affected negatively, but they were also eager to get some hands-on experience and valuable experience in the pandemic. And their psychological, they didn't really expect their mental health to be that affected. And legally, people didn't know what the situation was for them exactly. So I think there should be some regulation of this. So we can move forward. In Germany, students were very involved, and in a hackathon event just right in the beginning for health, they created a platform where we could match students who were available and eager to work in their region to mostly public health officers who needed help tracking or vaccination test centers. And this platform is still functioning, and then we actually extended it to the European level. This was really successful, and faculties mostly provided flexibility with internships so that people could actually acknowledge them for their studies. Move on, please. And in a local student union, it actually had a real positive effect on relations with students and the faculty, because we established a geofix, which was done really regularly in the beginning to sort out problems in every rotations, every clinical year, whether the vaccinations were on the roll and all those kinds of things, and it will be kept. So this is a huge bringing together faculty and students more. And also we did some structured evaluations, and a report was issued, and we organized COVID lectures to have the students up to date, just not from media, but from what our faculty's experts knew from their hand. Yeah, a surprise. I just told people when I entered the Zoom call, internet in Germany is really not good and devices are lacking, as we already found out. Next slide, please. And our takeaways were that we had a lot of digital platforms in use, some offered by the faculty, some commercial products, and most rotations finally incorporated flipped classroom approaches, and students also who are not that into medical education realized that it's a really effective teaching method, and they really wished for these options to continue because they felt it really boosted their learning when they could have this flipped classroom approach. Yeah, now that in between when we were able to have classes, we put the focus on beginners and graduates, and we recommended that there should be more opportunities for teachers to have digital teacher teaching and more proper incentives and opportunities for teachers. So that's from my side.
Thank you, Phillipa. I'll now turn it over to Lestat to talk about the local experience from Harvard Medical School. And I think there are no slides, right?
No, I don't have slides. I do have a few points that I want to make, but first of all, thank you for inviting me to this. It's a wonderful opportunity to be able to discuss this this topic with lots of different experiences across the globe and in one little Zoom room here. The 2 points that I wanted to make, and I'll try to be brief. First of all, and this goes back to my experience where we were pulled out of, I was in the clinical rotation here in March 2020. And toward the end of the month, that's when, as you all know, things were disrupted. We were taken out of the hospitals. And it so happened for me that the next month, April, was going to be my radiology rotation. And because of some incredible last minute efforts by the faculty who ran the radiology rotation, they were actually able to transition it completely to virtual. So it didn't really interrupt the course of my clinical year. And, you know, you can say radiology, it's amenable to a bit of a more virtual platform. You can review images, you can do it, but it still took a lot of work. And there's one thing that stood out, one of the efforts that I think behind the scenes must have been taking place to make this a success that I wanted to call out, because I do think it's an important element of virtual and in-person medical education, which is they recruited lots of residents to break out into very small discussion groups as we reviewed imaging. And that made all the difference. I mean, I can't tell you how many Zoom lectures I've been in where I'm just watching slides and I can't last more than 30 minutes. But the breakout rooms, we could be there all day, breaking in and out of the rooms and talking about imaging. And it was so interactive. It's just 3 and 4 students. You're talking, you're really engaged. And it reminded me of how first year education was, which for us was kind of, you know, 3 to 4 people at a table discussing problems, and that was a lovely time. Best year of education I've had throughout my entire life. And that I think is a key takeaway for me is it's very easy to set up Zoom lectures, really hard both in terms of recruitment and coordination to get these small groups going, but they are really worth it. So whenever the resources can be directed in that direction, I think that it's really pays off. The second point I wanted to make, and this is a bit more, could perhaps be a bit more controversial, and I'll connect it to my narrative as things started to kind of subside toward July, and then these discussions that initially we can't really have the students in the hospital. We don't even have PPE, and there were some really crucial supply issues that prevented us from being in the hospitals. Discussions started to the conversation started to turn toward the safety of the students. And that's something I wanted to talk about a little bit and see what other people's perspectives are. But I do have a strong perspective of my own. And I think as the pendulum swung around and eventually students were asked to, what it landed on is that, we can get to some degree of optimal safety, but we can never get to a risk-free situation with medical education. That at some point the students do have to come back to the hospitals, and we did come back in July. And I think that's something that to this point is probably still a point of debate, is that, and I think medical education inherently has some element of unsafety in it, that part of learning to be a doctor or physician is going to involve practical things like how do you effectively don and doff PPE? I mean, that you have to do that, and you have to do it not in a simulated setting. You have to really do it in a realistic setting for it to really set in. Things like how do you optimize the number of interactions you have with a patient who might have an infectious disease? Do you need to go back in 4 times to do that admission because you forgot the med rec and all that stuff that happens in real life? But I think in a larger sense, and a bit of a more abstract point, is that there's this, over the time you're developing a sense of duty to care for people, and that this is something that doesn't just get turned on when you graduate and grab that medical degree. I think it comes with time during medical training. And I don't think that duty to care means, throw yourself in a danger, be reckless. But it does mean, and I think this is fairly unique to only a few professions, is accepting a level of risk in your life that isn't present in most jobs. So yeah, I think I'll just leave people with that thought, which is something that I think COVID had exposed more to me and to the conversation at large that I hadn't really, it had been there before, but we just hadn't thought about it strongly.
Thank you so much, Lestat. And from there, we'll cross the Atlantic once again and go to the Southern Hemisphere, over to Azhar.
Hi, everyone. Hope that you are all doing well wherever you find yourself in the world. So next slide, please. I'd like to start off by providing you with some context into how the medical curriculum is structured at my faculty in South Africa. We have a 6-year medical program where year 1 and 2 focuses on the preclinical sciences, year 3 and 4 focuses on a combination of hospital and clinic rotations and theory, and then year 5 and 6 predominantly focuses on hospital and clinic rotations. So taking this into consideration, when the pandemic halted my medical studies in March of 2020 last year, I was at a stage of my medical studies where I had completed all the theoretical components, but also had significant clinical exposure. I was therefore in the privileged position to participate effectively in online case-based discussions and simulated medical scenarios, considering that my 4.5 years of clinical training provided a solid foundation for me to build upon. Next slide, please. When I reflected on how I negotiated learning during the pandemic, I was reminded by an academic mentor how this process I've undergone can be interpreted using Mesurow's transformative learning paradigm. I will therefore attempt to take you through this journey in a 5-minute presentation. So we are all familiar with the disruption of medical education by COVID-19 and how out of the disruptions emerged a transformative learning environment for medical students globally, and that is the online teaching and learning platforms. I aim to reflect on how I negotiated learning based on how the disruptions transformed my personal and professional development and as a medical student, and subsequently contributed to the ongoing development of my professional identity as a soon-to-be medical doctor. So number 1, the pandemic offered me with a reflective pause. I was able to practice enhanced self-directed learning. Since I was not on the clinical platform for 2 months when South Africa experienced its first hard lockdown, I wanted to use my time wisely. I therefore utilized this time to consolidate all the theory and clinical principles learned over the last 4.5 years during this period. In a normal environment, the curriculum is full to capacity, with clinical rotations ongoing, with almost no breaks in between. Therefore, there's not always specified time where one can truly revise the content learned in previous years. Previous slide. I'm still on the third slide. Yes. Where one can truly revise the content learned in previous years. So this was a great opportunity for me to effectively negotiate my own learning. In this way, the COVID-19 pandemic enabled me to truly practice enhanced self-directed learning, which retrospectively I can confirm has greatly contributed to my personal and professional development. Then moving to another critical component that I focused on in improving in this period, and that was my clinical reasoning skills. During the online learning period, our faculty provided us with virtual ward rounds in which we joined the medical team via Zoom, and also provided us with weekly clinical vignettes that we had to use using the SNAPS teaching approach to clinical education. So for those of you that know, SNAPS is a teaching tool that helps develop critical clinical reasoning skills. Using SNAPS, I was able to present clinical cases in an integrated, multidisciplinary, and interprofessional manner. Then, towards the latter part of our 5th year of the 6-year program, We commenced with what is known as student internship for the remaining 18 months of our clinical training. Since the training hospital where my university is based was extremely overwhelmed with COVID-19 cases as the main COVID-19 hospital in my province, my faculty needed to think fast and innovatively on how they will enable us to continue in-person training. This is when the 12-week ideal rotation, which in full is the integrated distributed engagement to advanced learning module, was born. In view of the unique challenges around COVID-19, the ideal rotation was crafted as a service and learning opportunity with two overarching objectives. One, to offer a learning opportunity that will enable students to integrate elements of most clinical disciplines through patient encounters based on a primary care philosophy. And two, to assist the health system in a time of need. I was now able to develop sound clinical reasoning and also apply the biopsychosocial model in the assessment and management of patients presenting with undifferentiated problems. And then, during this period, I was also able to cultivate my passion for medical education. So fortunately, my faculty values student engagement and participation in medical education, and therefore I was able to facilitate the restructuring of our elective module, participate in discussions pertaining to more effective assessment strategies to be used during the pandemic, and also liaise as a student representative with several members of the MBCHP committee. So truly, the pandemic provided me with an opportunity to be in sync with a grit and a growth mindset. Next slide, please. I would therefore like to share with you a research study that I'm happy to have been part of and which we are very excited to present at AME 2021. The study titled Grit and a Growth Mindset, Strengths and Opportunities Identified by South African Health Sciences Students During the COVID-19 Pandemic is authored by Veena Sundaram, Sahil Maharaj and me. Adopting a SWOT analysis framework, this qualitative study explored the personal and professional strengths, weaknesses, opportunities, and threats of final year clinical training during the COVID-19 pandemic. A national survey was conducted via social media using a snowballing technique, and student responses were analyzed and categorized into themes. This study reports the strengths and opportunities identified. Briefly, the COVID-19 pandemic has provided a unique opportunity for final year health sciences students to develop themselves personally and professionally and engage in opportunities that would otherwise not be available. Next slide, please. So to conclude, what are my take-home messages? Number one, the goal remains to produce competent medical graduates, even in a pandemic setting. Number two, it is important to engage in reflection, be kind to yourself, and maximize opportunities available to enhance your personal and professional development as future medical doctors during this unprecedented time. Number three, a collaborative approach to curriculum disruption that takes into consideration feedback from all sectors, that is faculty, medical teachers, students, the Department of Health, is pivotal to a successful transition into online learning and the eventual reintegration into face-to-face teaching and clinical training. And lastly, there's no limit for creativity during this time. Be innovative and be the change that you would like to see. Yeah, so that's from my side.
Thank you, Azhar. And last but not least, I put Abdullah at the end because he truly has a global perspective, more than most of us. So Abdullah, is your turn, and you can share your slides.
Thank you so much. It's really a pleasure to be talking to you today. And yeah, I will be presenting. So my name is Abdullah Al-Khafajy, just like Subha introduced me. I am the IFM's Liaison Officer for Medical Education Issues. And I'll be speaking today about bridging the impact of COVID-19 on medical education from the perspective of medical students and student organizations. So allow me to just very quickly introduce you to my organization. It's IFMSA, the International Federation of Medical Students Associations. IFMSA has been established in 1951 after the Second World War, and it is a federation that is composed of 141 national member organizations from 131 countries. We have 1.3 million medical students members, and we are recognized within the United Nations, the WHO. We work with WIFME, with AME, with UNESCO, with the World Medical Association, and we organize the largest medical exchange program in the world. So we believe in the local action. That's why our motto is think global, act local. And today we're going to mention that elaborately. So we will try to explain to you how did IFMSA investigate the impact of COVID-19 on medical education worldwide, and how was the status quo at that specific period, and what were the students' roles during that time. So it is not a secret that 2020 was a very, very hard year for medical students, for medical educators, and for healthcare education in general. So we decided to take some action, and there were two methodologies to investigate the situation. The first one was that we established an IFMSA tracking map for medical schools and how they responded to COVID-19 worldwide, as well as a global survey on the impact of COVID-19 on medical education. And we used our global student network to get some very valuable data that we will try to share with you. So here's what the tracking map looks like. And pretty much we have got responses from 2,761 medical schools in 103 countries around the world in the 20 days period from April 1st and April 20th. 2,640 medical schools in 95 countries. That's a very big number. That's like 95% of the medical schools that we reached out to have suspended their curriculum delivery in physical settings. And only 1,120 medical schools in 60 countries were able and were prepared to provide online education during that specific period, regardless of the quality, which we'll get into later. On the other hand, the survey also got some very good response rates. We have received 411 responses from 248 medical schools and from 68 countries from all the 5 regions of IFMSA that are pretty much similar to the regions of the World Health Organization. And this is a map that shows the respondents of the survey. And this is the report, the full report of the impact of the survey. And you can always take a screenshot here and read the full report if you're interested, and I can drop it in the chat later if you want. So some of the results that were very interesting, that the teaching methods, for example, have been shifted completely towards online lectures. And just like Lestat mentioned in his presentation, that the interactive methods have been reduced significantly, and more schools are being oriented towards online lectures only, which affected the quality of education and the engagement of students. Now, talking about e-learning and the virtual challenges of it, and is it an efficient alternative to the physical teaching? Is it an efficient alternative to the actual medical school setting? Are the teachers and educators ready to deliver online education? Is the communication proper and interactive? Is there a possible way that we can practice clinical skills and practical skills through online settings? Will we be able to provide qualified doctors or health workers? Because that is the ultimate product of the educational process, right? And will the health workforce be prepared to face the upcoming COVID-30 pandemic, which is something imaginary I just invented? And mentioning health workforce, we have to mention that COVID-19 has killed more than 1,700 healthcare workers in the United States alone. And we are having a necessity for more health workers, which are already deficient in most parts of the world. On the other side, if we are moving completely towards a virtual learning setting, then if, for example, I'm a student and I need to buy a book, then statistically, ebooks cost 2.20 more times than their print equivalents, which will also create an economical crisis for students. So there are many potential solutions for the current crisis, and e-learning is certainly one of them. However, it's very questionable about the quality and the end product of that online education. And many people are also questioning the pros and cons of online education, whether in the times of emergency, like in the COVID pandemic, or as an educational choice, because some schools were already prepared and already implementing online education. And especially in terms of the flexibility, the resources, the costs, the equity, just like Phillipa mentioned with internet, the target audience, the interaction, the assessment, etc., etc. So we thought that as a global network of medical students, we need to act, and we need to act now. So we started working on the global level and also on the national and local levels. So on the global level, we already mentioned that we believe in meaningful youth participation, because youth always bring new perspectives. Youth are good with technology. Youth are motivated to do something for a change. And some of the steps that we did is basically sharing and promoting a COVID-19 Open Educational Resource Center on ifmsa.org. So all our medical student members can have access to and even share with their peers, colleagues, and medical schools. We have partnered with educational platforms that provide open education during that time. Among them are some of the applications and corporates or firms that provide education in this slide. We have also started working on creating open educational resources ourselves. So we have, for example, worked with a company called ScholarRx on creating or establishing open educational resources that are scientific or academic, and students can work and share with their peers. And this is how they look like. On the national level, we have been sharing and promoting the work of our national member organizations. For example, this is a toolkit that was created by our NMO, or National Member Organization in Lebanon, that is for e-learning, and it was shared very widely and it went viral in a lot of countries. We have organized webinars on the COVID-19 pandemic and medical education with experts in medical education. And not only that, because we are a network of students in different countries, we know and we believe that medical students are indispensable actors in the fight against COVID-19. So we collected a lot of global testimonials, and we saw that a lot of our NMOs, a lot of our country representatives have been doing a lot of great things. And here are some examples from Bosnia-Herzegovina. For example, they have been having this peer-to-peer online campaign about COVID-19 measures. In Colombia, they have been working on fundraising and adopting a COVID-19 national strategy and other projects. In India, they have been working together with the government, the internship student year students. They have been working in airport screening. They have been working in COVID-19 isolation wards, quarantine facilities. In Morocco, for example, they have also been working with the COVID-19 emergency call centers, and then they have been in contact with the public, and they are being volunteering to serve on the front line. In the United Kingdom, they have also been working with the final year medical students to kind of mitigate the lack of health workers in pressure and high workload areas. And also they've worked with the NHS to provide support. So again, it's very indispensable to have medical students. Medical students have a core value. They can always provide the best hand for you in times of crises, in times of pandemic, in times of lacking medical education in curricula worldwide, and so on. So thank you very much for having me again. If you have any questions or intent to collaborate, always you can find me on lme@ifmsa.org. Thank you so much.
Thank you, all of you. Thank you, Phillipa, Azhar, Lestat, Abdullah. So now, without any further delay, let's go into the breakout groups, 4 breakout groups, and I've typed the questions for group 1 and 2 and group 3 and 4. Essentially, it'll be anchored by what the 4 of you have already said. So 10 minutes for breakout groups, and then the group reporters will come back and then present very briefly 1 minute and 2 tips from each of the groups, which then you can comment on. So as people are coming back, I hope everyone had as exciting a conversation as our group did. I'm sure everyone did. So I'll start with group 1. And Alessandra is going to present one strategy that was applied effectively during the pandemic from the educational side, and one missed opportunity?
Hi. So from our conversation, one of the positive aspects of this was, as Abdullah had mentioned, is prioritizing students in terms of getting them vaccinated. It did help them come back to the wards a lot faster, work on their clinical skills, and just have more interaction with their patients. And then in terms of the negative, as Subha, and I agree with Subha, is that we didn't engage the medical students early enough in terms of how to actually help them develop an online program. What would work best? How long should Zoom sessions be? So that was one area. And then Mady, who is a nurse clinician and educator, she has seen from a nursing perspective that there has been gaps between the nursing school nursing students graduating to their actual clinical skills in the hospital. They've noticed that a lot of clinical skills that they would prefer to do on hands, they kind of lacked during their end of online curriculum. So they are more of an engaged in person. So that was really impacted. And then the last one is the fact that it was just a very quick turnaround of going from in-person to online learning. So it wasn't as, students weren't quickly able to adjust altogether. But yeah.
Thanks, Alessandra. So group 2 reporter.
Hi, yeah, so we had quite a nice conversation, and I think the conversation was so nice that we actually focused more on the first aspect rather than also the second. And we had some exciting things. Christina spoke about the importance of inviting learners to participate in different ways and having them as active, participants in their own learning. Barbara spoke a little bit about reaching out to learners individually, having regular check-ins, creating, mutual reflection opportunities. Daniel spoke about how he chose not to work remotely in COVID-19 because he wanted to support his trainees in an in-person and empathetic way on the platform. And he also spoke about the importance of cultivating safe spaces. So that was a recurring theme, having daily touch-on conferences where, people can really share, the students and staff alike. And then Nutella spoke about the importance of, giving your students a pep talk, trying and boosting their morale. How can you, as an educator, move from one cubicle in your faculty to the next to check up on your students and ask, how is your day today? And what are you excited about today in this, pandemic environment where you can be quite not of the best moods? And then Karen as well just spoke about safe spaces, creating refreshing opportunities for both students and faculty to connect on a personal level in a time where you might not be feeling as connected as the past. So I think in summary, the importance of safe spaces, the importance of reflecting together, and the importance of, supporting each other rather than just expecting everything to come from the faculty's point of view.
Thanks, Azhar. We'll move on to group 3. And groups 3 and 4 is, if we could go back a year and do things over, what are 2 things you might do differently? In teaching and learning, there are many things we'd do differently, but we'll focus on teaching and learning. Group 3, yeah.
Thanks. It was a great discussion, actually, and question to answer. And actually, I had 3 points. So one of our wishes was to be more prepared for the digital environment, obviously, and the e-learning, but also to realize that you should just start and you can change things in the get-go. So a tradition, the real innovation approach is always to start at some point and to realize you do not need to have everything perfect in the beginning. And what we ended with was actually that we realized maybe something picking up what Ani said was that we should probably have protected the students less. I mean, some didn't, but some did. And they wished they would have maybe given them the more real clinical experience because it was also really important. And so that's the points I wanted to present.
Thanks, Phillipa. And group 4?
We too loved looking back and figuring out what we could do different, the power of hindsight, right? So if, a couple things came forth. The first is, everything did turn remote, but there was some, I think, really important discussion that the lack then of an educational community could easily break down. And it was a little bit to also what Lestat was saying when he presented, how the breakout groups are all the difference. But we were very much speaking how you can just, many students were studying alone, and that is not the best way to study, and there's a power to a community. The second was we would probably focus even more so on wellness, and though some of us did that and took the opportunity to take a break from the academics because things were put on hold, overall wellness was something that took a big hit across the globe. And so in retrospect, there's many ways to deal with that. And then I'll end with saying from a faculty perspective, the importance of always trying to find the most meaningful role for a student in the abilities they have is the sweet spot for success. And of course, if we knew things were going to be an 18-month crisis and they were going to happen this fast and all those things, we probably could have found the perfect role for the perfect level student to engage in.
Thanks to all group reporters. If I may, if people can raise their hand, all our South African colleagues, can you raise your hands? Okay, you can do, just indicate, because we want to welcome our contingent from the lovely country of South Africa, the Rainbow Nation, right? And a wonderful cricketing nation. I'm from India, so I appreciate the cricket in South Africa. And I hope to see all of you in the future. So what I want to do is, I just want to end with one slide. Okay. And it may seem, believe me, I want to tell people we did not rehearse any of this. But these are the lessons learned that I prepared last evening, which is we need to be adaptive all the time. Teachers, learners, educational leaders, institutional leaders, we all need to, and the pandemic forced us to adapt every day, change every day, as Phillipa said. And there are several strategies that were applied during the pandemic. It's very relevant to future health professions education, as our nurse educators said. We need prolonged orientation, and we've got to not assume the skills that people come with. Leaders and teachers don't have all the answers. This is what we can refer to as co-construction of education, which has been shown to be much more effective than when, the powers that be just dump educational strategies. Psychological safety is critical, and resilience is key. And I have here two pictures. And you might wonder why I have these pictures, orchid and dandelion. And I use this for a talk on resilience in Malaysia. And orchids are beautiful, but they need absolutely exacting climatic conditions and soil conditions in order to thrive. Dandelions, maybe not so beautiful, but very hardy and doesn't need anything. It will keep propagating. So which do you think is the more resilient, and which do you think we need to follow? So with that, I think we need to be dandelions, perhaps not orchids, in order to be resilient. Any last minute Q&As? I guess our 4 experts can stay on a bit longer. And once again, welcome to all our international friends. And I hope you keep on visiting us for future sessions.
And I'll just add, I do think the future of medical healthcare is in very good hands, knowing that all of you are the future leaders of healthcare throughout the globe. Thank you so much.
Thank you. And just a reminder, before you go, we would love a little bit of feedback if you're willing. I put those questions in the chat box. If you have just a minute to offer a few words about your learning experience, we would so greatly appreciate it. Thank you.
So I know I'm going to see Phillipa and Abdullah, at least virtually, at the AMI conference, and Azhar, and hopefully in person next year at some point. And lovely to meet everyone. And your acting vice dean, by the way, she was incredibly proud. I think she sent the whole South African contingent here to us today.
Thank you so much. I'm glad to hear so.
With that, we know the hour is tight. It's been wonderful to get us all together, and we have to do this again. We welcome you to any of the BEI activities or global cafes in the future. And again, I hope everyone studies hard, and I look forward to seeing you live at some point in the future. Have a great day, everyone.
Thank you, everybody. Wonderful conversation.